It's Sabbath again, and another attempt at putting things into words about my experience. And about my experience and about also what I see. I don't know how much I want to share details at this point, not many, about what I've been going through with healing. Yeah, that doesn't feel good at the moment. And at the same time, I I'm collective. My circuitry in human design is two collective channels, and my cross is all collective, cross of consciousness. My son is in gate 35 sharing the experience. So it is part of my process to share what I'm going through, what I see. Always hope that it brings something to someone else who needs to hear it. Because in my life, as I've gone through different things, I have come across, found, bumped into books, people, whatever, that share something that I needed to hear because it was useful in my journey. And so there's always a hope in me that something that I'm going through, especially if it's difficult, will help somebody else going through something difficult and possibly similar, or have some kind of crossover that it can be relevant. Just a couple of stories that I came across in the last weeks. With regard to health, quote unquote, health crises that people have been through. Not people I know, people that I came across on interviews and whatnot. And without the knowledge that came into my life in the last 2 years through Germanic New Medicine, and not just the knowledge, but putting it into practice and testing it. So whatever I'm saying, don't take anything I say as any kind of authority at all. I'm authority for myself only. Only. I'm an authority for myself. And that only after trial and error. So if you're listening, you go test it, research it for yourself if it sparks any kind of energetic something inside you. But I took the 5 biological laws of Germanic New Medicine and I tested them because they resonated with something deep inside me. I had already been questioning the medical paradigm as the daughter of a cardiologist, by the way, a well-respected cardiologist, and who, as growing up, I put my health completely into his hands for years, but always with doubts in my mind, of course, because I'm a doubter. Sun in gate 63, unconscious sun in gate 63, gate of doubt. So yeah, question and doubt everything, unless I can verify for myself. So there were always doubts and questions in my mind, and things didn't really make sense. But yeah, I grew up completely within the paradigm. I grew up accompanying my father at the hospital on rounds and loved it, and watching things, and little projector watching things. But seeing the better side, I guess, of the system at that time. Anyway, I digress. There were always questions because things didn't really add up, and because no one seemed to ever be able to explain why things were happening in the body. Why? When I started having, out of the blue, started having asthma, and was told I had to take medication for the rest of my life, my question was, why? Why did I not have this before and now I have this? And why do I have to take something for the rest of my life? Like, if I didn't have it and now I have it, can't I not have it again? Like, why am I now dependent on medication that is not something that naturally the body does, but somehow I have to depend on something that we fabricated to be able to breathe? It didn't make sense to me. I was in my 20s. And I questioned I was talking to one of the most famous allergists in the US at the time, a colleague of my father's, and I just was looking at him like, you're crazy. You're telling me that all of a sudden now I can never stop taking this. So I've always had kind of questions about things, but at the same time, I spent the majority of my life putting my health, the authority over my health, in other people's hands, just for lack of knowledge, lack of experience. But something inside me, particularly since I had my first pulmonary embolism in 2014, and I say the first because I've had a couple since then, but now knowing why. When I had it in 2014, along with a deep vein thrombosis, and the deep vein thrombosis occurred after the embolism, and I questioned the doctors because their narrative was that my embolism happened because of the DVT, and I said, well, but my leg only started with this insane pain after the embolism. And the reasons they gave didn't make any sense. They didn't have any logical sense to them at all. And I just looked at the doctor. I was like, it doesn't make sense. So I listened to what they had to say, but inside I was like, it doesn't make any sense. There's no logic to what you're saying. And it's crazy to me that you don't see that you're illogical. Without getting into details about it, but there are big questions in my mind. I mean, I am built for recognizing patterns. Channel of talent is a pattern recognizer. And the patterns were not adding up, I can tell you that. And so since then, the patterns haven't really added up for me in the medical paradigm that is imposed, and I'll say that, imposed on us. And so in the last years, big spark for me was the whole thing that we went through in 2020, 2021, 2022. And there was so much illogic in everything that was happening with this so-called new disease that I went down rabbit holes, and I just began, I was like, this doesn't make sense to me. There's so much illogic, and nobody around me seems to be able to see that there's no logic in these things, and in what they're saying, and there's so much propaganda and manipulation and lack of coherency. Like, it was very strange to me. And that is what brought me eventually, after many different trial and error with different things and supplementations and blah, 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 like, came to Germanic new medicine. And something in it was like, bam, this, not at first, I would say, actually not at first, because I saw it as something about psychosomatics or whatever. But as I started looking into it and saw the hyper logic and the scientific method, and the fact that I could prove it on my own, like, didn't need to believe anybody. I could put it into practice and prove it in my own body. Like, I could find out if it was true or not, by my own experience. And so I started testing it. And so that has been a keystone for me the last couple of years, and the process that I am currently in. I could not be going through this process without that knowledge and that experience. And that's what I want to say about, like, listening to other people sharing their experiences. listened to an interview with somebody who talked about having Lyme disease. But then when she explained the symptoms she was having, I was like, well, when you hear symptoms with Germanic New Medicine, you guide yourself by the symptoms. So if you have a certain symptom, you know which organ the program has hit, and it could be a number of them. But once you know the organ, you know where in the brain that has been affected, which brain relay has been affected, and then what the biological conflict shock theme or thematic or content is. So then you can find out, well, okay, what was the event that happened that brought this about? And when did somebody resolve it? Because the resolution brings the healing. And so as you see the symptoms, you're like, okay, I can see that symptom is a self-devaluation here, and then there was a fear or scare fright here, and so you can start seeing the narrative of what happens to people around you. I mean, as a projector, you get so much insight into the people around you just by seeing the symptomology. You know what's happened in their life in a specific way, but not knowing the exact details of. So, yeah, listening to this person and what she went through, and I could relate in that, like, some of the symptoms she shared are things that I've been having, but I have not sought help in the medical system. Whereas she did, and had the runaround for a while until she was trying all different types of meds. And it was interesting for her to talk about taking antibiotics, and while she was on them she felt better, and then she went off of them and she felt like crap. And it was like, yeah, that makes sense, because what antibiotics do is it pulls you out of a healing phase. So of course you feel better, but once you go off, you go back into the healing because you have to complete it. And when you don't complete a healing phase, it becomes chronic. So it was just interesting to hear these different things and hear what she went through, and be able to kind of dissect, like, okay, this label was given to these symptoms that are so incongruent, or like they're just so disparate. It's so, if you go look up any kind of so-called disease, I mean, the symptoms can be so varied and you can find those same symptoms in other labels of diseases. So then how do you really parse out which is which? And there are misdiagnoses left and right in the medical system. Like, there's just so much of a mess going on in that system. And labeling is at this point I see it as kind of counterproductive. And I see that with my own experience. Like, it's really not good for me to remember the labels of the medical system, because it brings on a whole mythos of what's going on and what will happen and what the prognostic is for your life from here on out, what your life is going to look like. And what labels are really triggering and can cause more problems. It can compound what's already happening. Another story that I heard recently was somebody who had I'm feeling like I'm not ready to share that, so I'm not going to. So I'll just talk a little bit more about this thing with labels. So different symptoms can be labeled in different ways depending on the doctor you see. Go to 3 different doctors and you might get 3 different diagnoses. Well, how does that help you know? Basically, it's like, okay, well, 3 different types of medication that they might give you, or 3 different protocols of dealing with the healing phase that you're in. So your body's already healing, and now there's 3 different ways they could try to stop the healing rather than support it. This is in effect what it is. And I remember when I was going through severe chronic pain with my hips and lower back. And I was, at the time, some 5-6 years ago, seeing all the doctors I could to get different points of view. And getting slightly different diagnoses. But it pigeonholed me. At the time, I was still wrapped up in this system, and I took on the label, and my mind created a whole thing about now what, and I started imagining, like, okay, now they're telling me I probably have to have this surgery that will leave me pretty debilitated for about a year, and I have no one to help take care of me. I live in a house where I wouldn't be able to get up and down the stairs. I wouldn't be able to even have a bath. I wouldn't be able, like, who would help me? Blah, 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 all these things. And my mind was going crazy, and I went into depression. I was already depressed with the symptoms that came. It already really brought me down. I was having symptoms that could also be labeled fibromyalgia, which is very vague as well. And I felt like, okay, I need to meet other people who are in this so I can feel supported. And I remember joining a couple of groups for one of the labels they gave me was developmental hip dysplasia. And I joined a couple of Facebook groups, and it felt good to interact with people who were also in the same thing. But actually, eventually I had to just leave that, because it became like a self-fulfilling prophecy, and like left me in this victim place. And not only the victim place, but basically seeing that there was only one way out, which was this surgery or hip replacement. And I mean, I took on that identity so much for a while, until something in me clicked and said, I heard, like, my body say, that hip surgery is not for you. There's another way. It's not going to be easy, but there's another way. And by the way, I'm actually still in that process, which I see now. What I'm going through now has to do with what was happening in my hips back then. And it's deep rooted in my life. It's from, childhood. So it's been a long process, and it hasn't been easy. Exactly what my body told me. But it's been my way. I didn't get hip surgery. And I moved out from that paradigm. But I watched how so many of us in that group, we just took on the label and became our identity. And then it pigeonholes you into like a future where you how do I want to say this? A future that somebody else has chosen for you, I guess. That the collective has chosen for you, because it's been a collective consciousness on this particular label. And I see how even right now what I'm going through is like, I know with the knowledge that I have now, I know what the symptoms that I've been going through could be labeled as, depends on who I went to see, but could be labeled as in the medical paradigm. And I know the mythos around those labels. And even though I've done a lot of deconstruction around labels, I see how it's still very triggering for me, and that it is an effort not to get caught up in believing that my life will look like forever, will look like what I see those people's lives are who are labeled that way in the system, dependent on the system, without realizing that what they are going through is actually healing that's never being allowed to come to its conclusion. I know I'm being vague because I don't want to share details at this moment of what I'm going through. But I can see that my symptoms have improved. They were severe in July. And then they lessened a little bit, and then they became severe again, but not as much as in July, and then they lessened a little bit, and then it's kind of gone in cycles as the body has moved into different layers of healing, body and psyche. So it's been this spiral, cyclical thing, but always with, I am much more functional now than I was in July. I had about 3 weeks where I couldn't leave the house. I couldn't get up off the ground practically. I had a friend had to bring me food, feed me. Yeah, it was not pretty. And then I went back to another couple of weeks like that in a milder way. I was a bit more independent, but I still needed that friend to bring me food again. Make sure I had what I needed to just, get by each day. And then that lessened up, and then, I'm independent again. I'm not 100% functional, but I'm not at all like I was in July. So I see that rather than in the paradigm that the medical system shares with their labeling, rather than my experience be that I have these symptoms and they get worse and worse and worse and worse, actually I have these symptoms and they're becoming lighter and lighter and lighter. They're still present, and I know that, the sense that I have is I'm going through layers and layers and layers of this healing. And so I can see that my experience is different from what the label would say. And I see how much my mind still is pulled toward those labels, and how much fear there is around that. Possibly that's the main thing I want to say at this moment, is labels can be useful. Of course, names can be useful. And they can be very harmful because of what gets attached to them and the meaning that we put on it, or the meaning that is given to it and then imposed. Language is so, it's malleable, and also it can get so fixed. And names are not just words, but they have a weight to them, based on our experience, based on what we've witnessed, based on what Wikipedia or Google or ChatGPT tells us, which may or may not be true. And so I see in my own experience this push and pull. I know the various labels that this could be given, and I know where that goes in the medical system. And it goes to not very nice places. And it goes to a life that is, quote unquote, condemned to a certain way of being not functional, really, and not independent. And can lead to interventions that would be debilitating, because there are plenty of interventions in the medical system that are debilitating. The interventions in themselves create problems. Yeah, the story that I was going to share, I won't get into details about it, but it was about somebody who had a diagnosis. And when I learned about what symptoms she had, I knew what she was going through. I knew that she was in a healing process for a certain organ system. So I knew, with the knowledge that I have, that she was in healing. But in our medical consciousness right now, we have this narrative that symptoms are illness and need to be cured. And it's very hard to flip that paradigm. It's been hard for me to flip that paradigm, even though I've witnessed it over and over and over again, as I was saying, in the last couple of years and in this particular process. Well, the intervention that she was given was brain surgery. And after the intervention, she was worse off than before. But in the belief that, her situation was believing that that was the cure. But a side effect, quote unquote, of the cure was dealing with the loss of sensation and motor capabilities in parts of her body. And she had to gain that back. Well, she had not lost that pre-surgery, and she wouldn't have lost that with her brain intact. Like, her body was resolving something, but in a way that's scary, the same way that mine is. And yet the intervention, the actual intervention, given the label that she was given, which is now that I know what I know, it was a false label. Well, the false label has this particular protocol or intervention, and that led to her being debilitated post-intervention, which she wasn't pre-intervention. Her story is a story of transmutation and overcoming, and it's a beautiful story in the way that she approached her own rehab after the surgery, and I won't take any of that away. It's beautiful. But in me is a sadness to know that she had to go through that because of what the medical system did to her. Not everything about the system is bad. There are good things there. There are good people there. It's that it's topsy-turvy. It doesn't, and I'm saying this as a 1-3, a first line, does not have a correct foundation. It doesn't have a logical foundation. It's based on a number of hypotheses, protocols, statistics, and pretty bad track record, I would say. A pretty bad track record, except in very emergency situations. So what's the moral of the story this time? Just labels. I think we need to be careful with the labels in any way, shape, or form, because they pigeonhole us. And we are, it reminds me, we are right now in the cross of planning, which is about labels. It's about gate 16 is the gate of identification. So, look around you. How much is identity politics, identity this, identity that? It's to the nth degree. that we're trying to identify or disidentify with this and identify with that, and I identify as, and for me, and I have gate 16 in a defined channel, so I understand the thing about identification, but to me, identification is something that happens spontaneously in that moment because it comes from the spleen. So it's, comes the awareness of the spleen, hits gate 16, and you have a spontaneous identification that can change the next moment, because that's the nature of spontaneity, right? It can be this now and it can be something else later, and it needs to be logical. And if it's not logical, you throw it out. But to build a life around a spontaneous identification is not very useful. And we have pigeonholed so many things by creating identification. And also in the background frequency, we have gate 62, which is the naming of things, and gate 9, which is this power for details. So it's like detailed naming of things to identify. And I'm saying that the individual is suffocated in that, and the individual story, and the capacity of you to live your individual life in your own individual authority gets stifled by that. I mean, all of that stuff is collective, and the collective in essence will always be about some sort of control, right? To keep everyone the same. So my story around my healing has the ability to be different when I let go of those labels. If I can know that they would be labeled in that way in the medical system, but that label actually means nothing, because it doesn't have to do with my experience. My experience is my experience. And what the body is doing is healing itself in its own individual, authoritative way, its own authority. I essentially share to hear myself, because I need to hear my own story and then hope that it brings something to somebody else. But there is a lot in the experience that I don't know or understand or realize until I've actually shared. And one main thing, and my projector friend who's been accompanying me in this process very closely has reminded me about, I talked to her about this thing about labels. We need to throw them out when it comes to the medical paradigms, because they're not in general very useful. Symptoms, look at the symptoms, but the label is not so useful. The symptoms just point to you to what's going on so you can understand what's happening in the body. And she has been the one to remind me over and over in the last couple of months, as I have thrown out the labels. People would say I have this. If I went to I would have this. Look, I'm doing this. My body it's like I have blah, blah, blah. And she reminds me, yeah, but that's just a label. It's just a label. And tearing off the shackle of the label, because it is a shackle, keeps you imprisoned in a paradigm. And I'm sharing this about the medical system, but really, like I said, any kind of label can really, even projector label, that can pigeonhole me, because I just am me. So they are useful, like I said, but as guiding maps, everything is just fingers pointing to the moon, in essence, right? Can use it, but the moon is the moon. The experience is the experience. Now I feel like I'm flying off into other things. But it is a reminder to myself that my experience is my experience. It's my experience, and your experience is your experience. and it can't be labeled because it's just life moving.